Hello everyone and welcome to this Careers Week video on educational fellowships. My name is Laura Conway and I'm one of the simulation fellows currently working cross-site. So what is an educational fellowship? It's the opportunity to take time out of your training to be able to get more involved in education. So it's usually a 50-50 year, with 50% being clinical and the other 50% being educational in a specialty of your choice. You are a trust grade doctor for this time. Some people find the benefits of doing education so profound that they choose to do it for more than 1 year, and it can be done at the SHO or registrar level, usually done as an F3 year between F2 and CT training, but it can also be done at the end of CT training before becoming a registrar. It has a wonderful opportunity associated with it to get those hard to reach places in your portfolio as well, like QIPs and potentially research. And also, we learn best via teaching, so it is a professional development year as well for yourself. So what does the day in the life of an educational fellowship look like? So as you can see from the pictures in front of you, there are a wide varieties of different teaching styles that you're going to be involved with. So on the left-hand side is a picture of the simulation suite with myself leading a sim for the medical students that we have. And I really enjoy simulation as it allows me to practice the practical elements of medicine as well as learn the interpersonal and human factors aspects that really do impact patient care. Next to that, you can see a picture of the Conquest Lecture Theatre, which shows that as an educational fellow, you will be involved in small and large group-based teaching with the students. So it's good to be able to identify which method is best depending on what you're teaching. Next to that, you're seeing a picture of my own laptop as I'm about to prepare a presentation for virtual teaching. This has become more popularized post-COVID as it allows busy doctors to be able to access teaching in ways that they wouldn't otherwise be able to. And next to that, you can see a picture of the Educational Fellows office at the Conquest Hospital, which shows that there's a lot of administrative tasks that are associated with preparing education. And we're not always delivering education. Some days are administrative days where we're going through emails and preparing the more logistically heavy teachings, like preparing mock OSCEs for the medical students. As well, in addition to this, there are also clinical days where you will be working on the wards underneath your clinical supervisors, as you normally would do as a training doctor. So what are the pros and cons of this job? I personally feel that there are a lot of pros as a simulation fellow, as I enjoy teaching quite a lot and I've learned a lot this year personally. However, from a portfolio standpoint, there's a lot of pros as well. So the pros being that you get a fully funded PG certificate from Brighton and Sussex Medical School, and you can either choose to do this in the area of generic medical education or simulation-based education. And the pros of this is that it allows you to become familiar with other forms of teaching you wouldn't otherwise be exposed to and reflect on your teaching for your own personal development. It allows you to get hard to reach opportunities like QIPs and audits through developing new educational courses for the trust, and potentially develop a research project that's education related with one of your supervisors. It also has a better work-life balance because you're doing 50% education and 50% clinical, and also that it's a trust grade job. You get more flexibility in terms of getting annual leave when you want it and going less than full time should you need that for your own personal reasons. Some of the cons of this job or things to consider is that it's very self-directed. I really enjoy this as I'm allowed to curate my schedule to what I need for my teaching and for my life. It's very logistics heavy, so in this role you do need to be very organized in terms of reading your emails, making sure you're up to date on the educational social media and communicating with the medical students so that everything is organized in good time and you have good quality teaching that you're delivering. And also, you need to have a general knowledge of all the specialties that you're teaching, despite the clinical attachment that you may have. So for example, if I am an educational fellow in pediatrics or in surgery, I still need to teach general medicine, obs and gynae, peds, and all the other things that the medical students might need from me. So what is a PG Cert? It's a postgraduate certificate, which is being done by Brighton and Sussex Medical School and is funded by the trust in this position. So there are 3 core modules that are associated with it. One, which is surrounding learning theories and understanding the academic basis of what you're teaching. Another one being building your own educational portfolio in the realm of medical education to improve your networking above and beyond this year. And the third module being around advanced communication skills, learning how to provide lectures as well as speeches and motivate your colleagues in a team-based setting for the purposes of enhancing your educational program. This is really good for networking, your own professional development, and as I said before, it ticks those boxes on your portfolio in terms of getting those extra points for accreditation in teaching specifically. So at the end of the year, once you have completed your PG Cert, you can go forward and then get special accreditation with one of these affiliated bodies, either with the Academy of Medical Educators or potentially the Association for Simulated Practice in Healthcare. And this is really good as it demonstrates that you've studied medical education, that you know what you're talking about, and that you are affiliated with a national group going forward. So how to get more involved if you're interested. There are a variety of different ways. So shadowing the current educational fellows I would really recommend because it allows you to get involved in every single aspect of teaching, which is really important. It allows you to facilitate teaching as well as assist with teaching. A lot of people don't develop courses before this role, they just assist. And I would recommend if you get the opportunity to try and develop the course under the guise of an educational fellow because it helps you to appreciate logistically what's involved and the best way of going about teaching certain topics. There are different educational conferences that you can get involved in, AAMI, BME, those are both national educational conferences, AAMI being international, and ASPE, the last one there, that is specific to simulation if you're interested in that form of teaching. And the last being educational publications, so a lot of people will submit abstracts or help to develop new courses which can get published in recent educational journals like the Journal of Interprofessional Education or potentially BMJ Education. So if you're interested in this wonderful experience, please do reach out to the leads that you can see on the slide. The jobs are posted regularly on NHS Jobs and on the Extra Night website, usually between the months of February to June. So there's plenty of opportunity to consider whether or not you want to do this going forward for your career and to make sure that those applications are submitted on time. Thank you for watching this video. I hope you do decide to become an educational fellow in the future, and I hope that this video has helped you to decide whether or not it will be beneficial to your career going forward. Bye for now.